Please read this scenario carefully and proceed. This scenario is taken from the MRCP Paces side, and it is recommended by the MRCP UK. What I am going to discuss may not be the 100%, but what I feel is the correct I am going to discuss. And any person, if you want to give any suggestion, you are most welcome. So read this scenario carefully, and then we will talk about. So reading this scenario carefully, you can find there are some key issues that before you are going to discuss with the patient, you have to understand that what are the main key issue. So here the patient is in the advanced stage of the dementia. Next is the patient is also mentioned that she is not in distress, so that also you have to understand. And another issue is what is the best for the patient. So at this moment she is quite sick and not in distress. So at this moment, so giving any aggressive treatment or investigation is not appropriate. So maybe the examiner want to judge you by the patient may ask you that does she need some more investigation to find out what is going on with her. But you have to tell it is not at all advisable at this moment to go for any kind of the investigation. Our approach is to keep the patients without any distress and as much comfortable as possible. So this is the main thing, and she basically needs the palliative care. So you have to keep this key issue in your mind. And also the one thing which may be raised by the patients about the artificial feeding. She is not eating, and it is not appropriate, I think so. So why not you are starting some kind of the food, and you can give some IV fluid. You can give her some food through the tube. So this question is just judging you that what are your knowledge regarding that and what are the recommendation. So it is the new guideline is artificial feeding is harmful for her. So you have to tell that if we will start any kind of this kind of artificial feeding, it is going to harm her. It is not going to help, and she may be more distressed. So you have to talk like that. Then what are the questions which may the surrogate can ask, as it is suggested by this scenario in the mentioned sheet. So she may ask you, why did my mother become ill? Why did my mother become ill? It is difficult to be answered, and you have to tell that it's maybe age-related condition which affects some of the people. If she asks more question about how it happened, you have to tell that so what is we think about and the latest information that in our body there are some waste material, waste protein that get deposited inside the brain, and it lead to this problem. And then another question she may ask, is the vomiting related to her dementia? You have to tell that we have done some tests. The one of the tests is we have done the camera test, putting the camera inside the tummy, and also we done the scanning, that imaging test of the tummy to find out that what is the reason for, and all the reports are normal except we find that there are some changes inside the stomach, inside the tummy, and that is what we call the gastritis. And we have treated, and she is now quite well, and she is responded well. Next question she may ask that should she not go back onto the tablet to treat her dementia? It was already tried and the tablet was given, but she was not responding at all, and at this moment giving these tablets can be harmful for her, and it is not of any use. So you have to mention this thing also. Why will she not eat and drink? You have to inform that this dementia, and in the layman term you have also tell that it is a memory problem, and it is in the quite advanced stage in which the patient is not aware how to eat and no interest in the eating. Next question is she suffered? You have to tell no, she is not in any distress, as it is mentioned in the scenario. How long will she live? She can ask this question. She is at the end stage of the life, it is difficult to predict, but it is short period. So you have to tell that it is difficult, but it is quite short period. You have not to give wrong information. You have not to tell that wrong assurance as well, that she is going to live a quite long period of time. So you have to be give the correct information. Then another crucial question that can be asked, that can I take her home? So you have to tell that it depends on her wish, because we have to respect the patient wish, what she has told before, or if she has any advance directive, we have to follow, we have to respect it. And also the wish of the patient next kin and the family member is also important, and if they are able to keep her more comfortable at home, it is better for that she have end of life at the home as well. So you have to answer like that. So now we will talk about how to start. So first, when we are going to talk to the patient, we have to first introduce ourselves and to confirm the identity of the patients. Like, my name is XY and you are Mrs. Mary John, whatever her name. I have to look at again. So you are just assuring that what is her name, and I think you are the next kin of this patient. Can you tell me what is the relation? So you are just asking that what is the relation between the patient and the person you are talking with, and then you have to set the agenda. You have to tell that today I am here to talk about your mom condition. So what you know about her, and that is also you have to ask. But you have to set the first agenda that I am here for your mom and to talk about her condition and what is the best for her. Making the repo is also important, that I am here and my team is here to help you and your mom, so that what is the best for her, and we will do whatever the best possible things to keep her more comfortable. And so making a repo and making a relation with the surrogate is also important. Then coming to the understanding, that you have to talk that what she knows about her mom condition, what is the exactly problem she has, whether she knows or not that she is in the advanced stage of the dementia, the advanced stage of the memory problem, and what are the test was done when she was vomited. You have to mention that the imaging test and the camera test was done and it was normal, no finding is there except some gastritis was there, and for she was treated. But at this moment the memory problem, what we call the dementia, is in the quite advanced stage, and due to that she is not eating, but she is just eating little bit, and we, our team, are here supporting and taking care, and the nursing, all the experts are with her and trying to help, and the palliative treatment is also there to help her. And if you have any question and any of your relative, we are together so that we can support her and keep her comfortable. And then you have to talk the management plan, that at this stage what you can do, that only main treatment issue is here is the palliative treatment. Keep her comfortable, not to give her any kind of the distress, like doing investigation and doing further any kind of the procedure which can rather give her more distress rather than any benefit. And then last in the concern, you have to ask the patient's concern and briefly end this issue. And so anybody, if you want to give any comment and any further discussion, can give the comment below. Thank you very much, and you can also subscribe to my channel. Thank you very much.